Welcome to the In Chamber, the place where we focus on the issues that shape business success. I'm your co-host, Rebecca Patrick. I'm joined by Anthony Shutley. This is the first episode of season 5 and our first turn at the microphone. Though I'm new to the podcast, I've been at the Indiana Chamber for 18 years and am the Senior Vice President of Communications. Anthony may be familiar to many of you as a longtime writer at the Indianapolis Business Journal. He joined the Chamber in June as Director of Communications. In Chamber is presented by Work and Learn Indiana. Our guest today is Jennifer Pferrer, the Executive Director of the Wellness Council of Indiana. Jennifer is going to chat with us about two important topics. One is the COVID Stops Here employer recognition campaign and latest workplace trends related to the pandemic. The other area is mental health, which has become so important over the last year and a half. And it's something more employers are recognizing. Jennifer, welcome.
Thanks for having me today, Rebecca. Anthony.
The Chamber and Wellness Council launched the COVID Stops Here employer recognition campaign in late August. First off, Jennifer, what is the campaign about?
The campaign is about recognizing employers that are really leading the fight against COVID and playing an important role in improving the state's vaccination numbers. Companies with at least 70% vaccination rate can receive the designation.
Why did the two organizations feel the need to get involved?
Well, I think that there's a lot of reasons, but Kevin Brinegar, the CEO of the Indiana Chamber, really says it best when he says that the more Hoosiers that get vaccinated, the sooner our businesses and the lives of our citizens can get back to normal. And when we think about the role of employers in today's society, the 2021 Edelman Trust Barometer indicates that 72% of Americans trust their employers. And that's significant because previously, the trust was in the media, and that number has dropped to under 52% of individuals trusting the media when it comes to information. So the role of the chamber in trying to amplify the employer voice during this pandemic really brought us together to recognize these employers.
It's been real interesting for me to watch the campaign unfold. And admittedly, I lack a little context. I've been with the chamber a little over 3 months, but I remember, Jennifer, that we were working on another video about the campaign early on. And, people were coming in and informing you that, this company wanted to be upgraded in their status, or this person, this company wanted to report their status. There seemed like just a lot of excitement around the campaign. So I'm curious, as we've been into the campaign a little longer, what's been the response from employers statewide?
We have over 265 employers at this point that have submitted for their application and been designated. And we have many of those employers that have gone up in level. So they were initially at a 70% rate. Now they're at an 80%, or maybe they were 90%, and now they're at 100%. I think the thing that's interesting is that when we look at the numbers of companies that have come in, a significant number, more than 45%, are at the 100% vaccination rate. So employers are interested. And, when they apply, they get a toolkit that they can use, a media kit, where they can use a logo and they can have sample communications around how to send this to their internal audiences as well as external audiences. And, employees want to know that when they come to work that they're safe. And this campaign allows them to send that message. And customers that are attending or coming into a place of business, they also want to know that they're safe. And this campaign has allowed employers to, promote it externally to their partners and their vendors.
It's definitely been a very encouraging response that we've had so far. One thing I do want to make clear is that the Indiana Chamber and Wellness Council aren't advocating for vaccine mandates. That's something the Chamber has stated should be left up to each individual employer. But that said, we also do have a federal vaccine mandate looming for employers with more than 100 workers. Details were quite vague last month when it was announced. Jennifer, do we know any more about how that is going to roll out in practicality?
Well, I think that the guidance is still vague, and we do expect that we will have more details in the coming weeks. But I think that what this does for employers is it gives them the opportunity to plan and put their plans in place. Understand that they need to be able to track vaccination rates. How are they going to do that? What are they going to do? Make sure that if they're going to go the testing route, how is that information going to be captured? Because this is a part of OSHA. OSHA can come in at any time and ask to see your policies, to see your records, and the employers that are impacted by OSHA have to have this information. So start planning now. The guidance is coming. We know that it's coming. What we really encourage employers to do is check back with their legal team for one, but also check back with us, because we are going to be posting some additional information in the future to give some guidance to employers in Indiana.
Is there any other specific guidance we can give, and I guess in terms of readiness for when this mandate will go into effect? Because as you alluded to, if you get caught unprepared with OSHA for a violation, you could be at risk for a pretty significant fine.
Well, the indications that we're receiving will allow employers at least 30 days to put their plans in place and to ensure enforcement. So there will be a little bit of lead time that will be given. But again, now is the time to plan. And the other thing is that we really feel like a lot of employers are already tracking some of this information. So just make sure that your policies align and that you are putting things in place. One of the key things, or the key elements of this mandate, is the time off, employer policy regarding time off to receive the vaccination. And if there are indications post-vaccination that you might have to stay home or stay, maybe you have some, maybe you get sick from the vaccination, which we have seen documented from time to time. Again, what is your policy? How is your policy written? And does your policy really support giving that time off, that paid time off for individuals when they go and get their vaccine? So I think that it does look different for employers, but now is the time just to prepare. It's all about preparing. And, there are so many stipulations. It seems like it's going to evolve multiple times between now and the time that it's released. But again, we do expect that within the next month, we will have additional guidance, and we do expect that employers will have a lead time, probably 30 days or so, to get plans in place.
Time flies when you're having fun, and maybe it flies even when you're not having fun. It's almost unbelievable to think that we've passed the 1.5-year marker for the pandemic. And it's been interesting for me to watch it unfold. I mean, I've done a lot of that as a journalist, and the response that I got from companies that I interviewed early on were really the first thing they wanted to know was what were other companies doing, or kind of what was happening in the world. Almost, it seemed like everybody was really siloed, and company executives really wanted to know what each other was doing and what they should be doing. I'm wondering, Jennifer, what you're hearing from employers at this stage.
Well, I think it's interesting, right? Because they're like, we're still here. Everybody had thought that they would be back in a normal workplace setting, and those return to office dates continue to get pushed back. I think that a lot of employers are seeing the surge that we're seeing across the state in COVID cases. So they're still trying to figure out what that looks like for their day-to-day business practices. But I think at the end of the day, we're all still saying, I can't believe we're still here. I can't believe we're still having this conversation. And normal is going to be different, right? If we think that we're going to go back to a normal business practice, we just have to be comfortable in knowing that we're going to be in a different place and we move forward from there.
It's been super weird too. We kind of had this start and stop kind of a thing. I know when I started the chamber, it almost seemed like we were back. I mean, we At the chamber even had kind of this, all employee lunch kind of a thing. And we were being safe and social distance, but it seemed like we were back. And now it seems like, oh my gosh, we're kind of back where we were, a year ago. How are companies dealing with that part of it, Jennifer?
Well, I think that we're truly living through history. And when we think about how things are going to evolve, we believe that we're on this course, but the virus mutates and it causes us to pivot a little bit. So I think employers right now are trying to be as nimble and flexible as possible to support their employee population, which I think is really important right now. Employee health and well-being has really been elevated during this time, and it really shows that employers need to be more about making their widgets, but taking care of their employees as they go through this pandemic. But being flexible is the number one thing that we're hearing, and going in directions that they never intended or never thought that they could go. So flexibility, staying present, keeping a ear on what's really going on out there, and being able to pivot when needed.
Now, a quick word about our sponsor. Work and Learn Indiana is where work-based learning connections are made. It's free, it's easy, it's a win for both Indiana learners and employers. Its newly updated website hosts Indiana's largest statewide marketplace of work and learn opportunities that promotes talent and career development. Details at workandlearnindiana.com.
You mentioned well-being. One aspect that obviously is factored in all of this the last 18 months is mental health. It's not something that was really talked about too much, it seemed, before then. How has the pandemic brought all of that to the forefront and set the stage for us a little bit of where Indiana is with mental health?
Mental health has definitely been elevated during this pandemic. And when we look at the numbers and what we're seeing, the CDC in a pulse survey indicated that Indiana is number 16 when it comes to overall poor mental health. And that's a significant number, 16 in the country. We're on the bottom of a lot of lists, and unfortunately we're on the top of this one. And when we looked at some other statistics, Indiana is number 2 for severe depression. And we're currently ranked number 4 when it comes to suicidal ideation. And those are key factors when we think about the workplace, because people are showing up at work, whether it's walking into a physical office or sitting down at their dining room table to do their work. And these challenges don't leave when they log into work or when they walk into work. It's something that employers need to really think through. How can they support these individuals? And most of the issues that are going on are not physical, right? Physical health is different, but mental health is something that you don't necessarily see. And we all have mental health. We all are in a place where our mental health is being challenged in ways that we've never, ever seen before. And we look at a SHRM survey, they report that 55% of individuals are currently having little or no pleasure since COVID has hit in their daily activities. And, that's concerning and that's sad. But I think that from an employer lens, the thing that really is concerning to me is that if in a recent survey, they indicated that less than 30% of employers would hire somebody that had a mental health issue. And in the time of labor shortages and hiring issues, if we only have 30% of employers that are willing to hire somebody with a mental health issue, that's significant. That's a workforce issue. And as we think about how do we ensure that we have employees that are showing up being their best self every day, if we have employers that aren't willing to have those conversations and engage in helping individuals navigate the mental health issue that they're having, then we're missing a significant opportunity.
It's been real interesting for me, Rebecca, as I kind of think about the mental health part of it. I consider myself pretty stable for the most part, but you know, when we entered the coronavirus pandemic, I felt like that I was holding up pretty well, and I saw that my wife was holding up pretty well. But I kind of saw a path to an end in a way. I mean, I saw, well, we're working on the vaccine. Once we get the vaccine, we're going to be okay. And I've just found for myself personally that, from a mental health standpoint, it's been a lot more difficult this time around, this second wave. We have the vaccine. I think a lot of people have done everything that they can to kind of mitigate the pandemic. And yet kind of here we go again into this mini lockdown. And it's been, mentally much more difficult for me personally this time around. And I don't know how, you guys feel or you think others are doing. I'd be curious about your observations there.
Well, I think the easy answer that everybody is putting out there is everybody, I'm fine. I'm fine. How many times do you get asked that question? And what you'd really like to say is, oh no, I'm really struggling, or wow, there's a lot going on. But we're all wired in that response to say, I'm fine. And I think that's one of the things that we're seeing from employers and employees is that when they walk in the door, I'm fine. And that's really something that we really need to be better at. As individuals, we need to be able to pause and reflect on how we respond to that. But when we ask questions, we need to be mindful about, are we really asking if they're fine, or is it just a pass by conversation that you're wanting to have and you're wanting to go on with your day? So.
Related to that sort of sharing of how you're truly doing, I was looking at the Kaiser Family Foundation's, I believe it was their latest survey on mental health. It found that over 27% of Hoosier adults 18 or older reported symptoms of anxiety or depression. And most of those, nearly 20%, said they sought no professional help with how to deal with it. That was sort of a wake-up call for me to hear. The second finding there seems to speak to the continued stigma around mental health or mental illness. Jennifer, how real is this stigma, and has it improved at all over the course of the pandemic? Or more conversations starting to happen?
More conversations are definitely starting to happen, but stigma drives silence when people are not able or willing or confident that they can share where they're at. And that silence really prevents individuals from seeking the care that they need. So stigma is real, and breaking the silence on mental illness will encourage those who need help to seek help. And right now, that's really difficult. What we need individuals to know is that it's really okay not to be okay, and there's a normal. We need to normalize that. We need to let individuals know that it's okay that they aren't okay. And when we think about going to ask for help, to your HR team to ask for help, that's hard because you believe that you're going to be maybe put in a different category of somebody who's unstable or somebody that is having some real issues in life. And again, we all have mental health. And so how we deal with that mental health really is unique to each of us. And stigma really stops people from seeking the help that they need. And especially in the workplace where they don't want to be labeled as having issues. And I think that what employers can do right now is ensure that, their mission and vision really aligns with their daily practices, and that, leadership and C-suite they're modeling that, mental health, physical health is really important to them. And that if they can model that behavior, then their employees will follow suit.
The cost of mental health struggles is pretty obvious for a person. That's clear, and that's obviously very crucial and the most important aspect. But what's sort of the cost of health beyond that, maybe to employers? What's the productivity and financial cost there?
So when we think of the cost of mental health, again, it's something that we don't typically see in an individual, but we know that employers that will invest in mental health will see a return of 4 to 1 for every dollar that they invest. And, again, mental health, investing in mental health is investing in well-being conversations and investing in taking care of your employees. And we also know that the cost of mental health shows up with that mental distress and the reduced productivity, the absenteeism that we see. Employers that invest in mental health see a decrease in their disability cost. But dollar for dollar, organizations that spend they will spend over $15,000 on average annually for each employee experiencing a mental health issue. But it really doesn't stop there, because 67% of individuals that have a mental health condition also have a chronic health condition. And when you add that on top of it, you see that mental health is very, very expensive. And we're seeing it in the top 10 spend of employers these days.
Jennifer, I know that you had mentioned earlier a little bit about some of the steps employers can and have taken. But, as I've observed and reported on businesses for years, I've seen these little mini battles in between within companies of, maybe the HR department is kind of fighting for one thing, but the executives are kind of focused on the business end. So I guess I'm curious from your perspective, how much buy-in does a company have to kind of take on these mental health issues, and does it need to start very top, or which department within a company should be dealing with these issues?
Well, everybody's dealing with these issues. So where you get the groundswell can either be from the top down, and you have a leader that is committed to either sharing their story or getting behind the effort, or it could be from the bottom up. And the bottom up could be that you're looking at all of your data within your healthcare realm, and that you're seeing that, oh my, we're seeing an increase in antidepressant medications. We're seeing an increase in absenteeism. We're seeing an increase in some of these key data points that will indicate that our employees are struggling with mental health. And the opportunities for leadership is to really, again, reinforce that it's okay not to be okay. And we will have tools and resources available for you when you need them. And leaders need to understand that they have to align their mission and their vision with what it is that they're saying. And if there's a disconnect, there's a disconnect in trust. And if we can leverage the trust that employers have right now and ensure that we have alignment within our mission and vision, we can help these individuals. But leadership has to buy in, but they might buy in for a number of reasons, right? They might be dealing with their own personal mental health issue, or they're looking at their data and how it's impacting their workforce.
And do you see that buy-in, or do you feel like we still have a ways to go? I mean, from the very top of the company, do you see that buy-in?
I think that we're starting to see that buy-in. I don't think that it's evident everywhere. We have conversations with employers that a very specific conversation I recall was that I just need them to get themselves together to come and be productive at work every day. And until they do that, they really don't need to be working for me. That's unfortunate, right? It's, again, especially now when we're in this labor shortage that we're all trying to figure out. But we still have a lot of work to do. And the stigma around mental health and really what it is and what it isn't is important. And we'll continue to beat that drum to let people know that they need to be telling their story, and we can support them in that.
And so what are maybe one or two concrete steps that a company could take to help their employees in this regard?
I think the number one thing is that they need to understand what they're offering their employees. Are their benefits aligned to support good mental health? and understanding exactly what that means. And that doesn't mean reading your employee handbook and looking at your benefits and it means calling and understanding if I'm calling to access my employee assistance program, what does that mean for me as an individual? And what does it mean for each of my employees? So I think aligning in making sure that their benefits align with their mission and vision and what they're trying to accomplish is definitely one thing that they can do. But I also think that they need to make sure that they're over communicating the need for good employee mental well-being and communicate in as many different ways in as many different times as you possibly can about that mental health is important. And again, the language matters. So as you communicate, make sure that you're using appropriate language in that everybody can understand. But I think the one thing is to understand that mental health is personal, and whatever you're offering as an employer, it is not a one size fits all program. It has to meet these individuals where they're at, and they need to be able to access the resources that you as the employer have available for them. So one size does not fit all is probably a key takeaway that I would like employers to leave with. But again, I also believe that as we go through all of this from the pandemic, that the number one thing is that we all just need to breathe. We all just need to take a moment and breathe and understand that we are going to be okay and we are going to get through this. And maybe we're not going to get through this, but we're going to move forward.
One specific mental health issue that unfortunately seems to be on the rise is burnout. A lot of employees have assumed additional responsibilities due to labor shortages and just the ramifications of the pandemic. How can employers spot signs of burnout early, and what can they do to minimize this in the workplace?
We've talked a little bit about how this is personal and everybody has their own mental health. But as managers and supervisors, we can spot when things are just a little different, a little off, that employee who has shown up every day on time, ready to work, engaged in the workplace. And then all of a sudden they're late or they're calling in sick or they're, that's a flag. Or if somebody who has really been super engaged and they show up very professional and they're unprepared, and look for those changes, in your employees, and don't be afraid to ask, are you okay? Is there something that I can help you with? Because that is where employers have a very important role. You don't want somebody to be unsafe at work. And if they're distracted by something going on in their own personal life and they're struggling with a mental health concern, it could be a safety issue. So employers can train their supervisors and their managers to spot those changes. There's a great program through Mental Health America called Mental Health First Aid, and it allows supervisors and managers to understand how to spot those changes and what that means. It doesn't mean that you become a counselor and that you're, offering peer support for that individuals, but what it does mean is that you're familiar with the benefits that are provided and you can direct that individual to get the aid and the help that they need.
Whether it's due to ramifications surrounding COVID-19 or the mental health aspects that we've talked about, one other unfortunate thing that we're seeing is a lot of people changing jobs or leaving the workforce altogether. This is called the Great Resignation. What are ways employers can perhaps regularly check in on the general wellness and mindsets of their workers to hopefully mitigate this having happened to them or having too much impact on their workplace?
I think if employers can really have the mindset that it's part of their job and their responsibility to ensure that their employees show up every day and the employer is there to help them be their best self. I think that if employers can really understand that the way that they historically have done business has changed and it has evolved. And if they think that they're going to go back to what was normal, they're going to lose their employees, because employees are wanting that flexibility. They are wanting, a work environment that's going to be perfect for them. And again, what's perfect for them isn't necessarily right for the person next door. So employers have to stay in tune and in touch with what their employees are saying and what they're seeing. And they have to ask, they have to ask what their employees are wanting right now, so that we can ensure that that they're not going to leave to go someplace else. Because what used to be driven by, how much they're going to make, those other benefits are becoming more and more important. And, the benefits that are offered are changing, right? We talked a little bit about dogs, and pet insurance is something that we're seeing some employers offer. Well, that's pretty interesting. There are a lot of places that we can do that. But the other thing is to ensure that your supervisors are prepared to understand what's going on. And we're seeing empathy training for employers and supervisors, so that they can be more empathetic. The resiliency training on how to help your supervisors, through some of these very, very difficult times. And their benefits, the benefits of telehealth is huge right now. And what does that look like? And maybe there's a maternal child program that's going to help those individuals that are in the childbearing ages. But ensure that the employers need to ensure that they're checking in to know what their employees need, and then adjusting their benefits and their policies to support that. Flexibility is going to be the key.
As we wrap up here, are there one or two other things that you want to mention? What do you want employers and employees to take away from the conversation?
Well, I've really touched on a lot of the idea that it's okay to not be okay is really important. And the other key piece of information is that we need employers and leaders to model behavior. We need them to be comfortable sharing where they're at, and from that mental space, and not feel like they have to be that stoic leader that really doesn't show any emotions. We need individuals to know that we can model that behavior, and we can have others follow us as we go down that path. And again, from an employer standpoint, training your supervisors and managers to support your employees is so important, because it will, people leave managers, right? And when people leave organizations, they typically don't leave the organization, they leave their managers. And if we can train our managers to be empathetic and sympathetic and guide them through some of these difficult times in life, then they will stay. And I think it's just really important that employers understand that it is not a one size fits all approach. And talking to other companies, you can learn from them, and you can learn from what they've done and then what they've tried and what's worked and what hasn't worked. But we have to start somewhere. We're not going, we have to start with the end in mind, and that journey is going to be different for every employer and every employee. But we have to start somewhere. Start small. Start with the communication. But please start. This mental health conversation and this physical health conversation is really our future, and we have to not be afraid of having that conversation. So the number one thing is that we can't be afraid, and we have to move forward and start that conversation today.
All great advice, Jennifer. Thank you for joining us and kicking off season 5. In Chamber is presented by Work and Learn Indiana. Learn more details of the COVID Stops Here campaign and to apply for your designation at indianachamber.com/stopcovid. Mental health offerings and other programs provided by the Wellness Council of Indiana are available at wellnessindiana.org. Before we sign off, we are pleased to announce the return of the Chamber's marquee business event. Our annual awards dinner on November 9th features racing legend Roger Penske in a one-of-a-kind conversation with Governor Eric Holcomb asking the questions. The event takes place at the Indiana Convention Center. Tickets and tables are available at indianachamber.com/AD. We hope to see many of you there. As always, thank you for listening.